I'm Dr. Howard Koh, U.S. Assistant Secretary for Health for the Department of Health and Human Services. And I'm here at the 19th International AIDS Conference in Washington, D.C., the largest AIDS conference in the world. And I'm absolutely delighted to be here with my friend and colleague, Dr. Eric Goosby, who is the U.S. Global AIDS Coordinator. And Eric, welcome.
Thank you. I'm very pleased to be here.
So, Ambassador, you've had quite a career. You've been a frontline physician and HIV provider. You've run federal programs, and now you're the President's U.S. Global AIDS Coordinator. And here we are at this historic meeting. Tell us, in your view, how we use all the information that's been shared here to work together to head toward an AIDS-free generation.
I guess that it is always a thrill to convene the people who come to these meetings. You have everyone from scientists, policymakers, but just as importantly, you have people who use the services, people who have formed community organizations to try to identify and retain people in services over time. You have also activists that are taking and challenging policymakers and program implementers to do it better, do it correctly, and to change their focus as the needs of the population change.
So you've been at this for your whole career, and I know this is very personal to you. So at this historic moment in time, just tell us some of your thoughts that you're feeling from within your soul, if you will, about the future and where we need to go.
Well, thanks. I do think that this is an important moment. We have the convergence of science that has basically given us a blueprint map that we can use to really look at what and how we can identify, enter, and retain people effectively in care for really what is the duration of their life with HIV. Those subtleties of retention, creating those safe spaces for populations that participate in the highest risk behavior becomes a real challenge. We deal in the President's Emergency Plan for AIDS Relief, PEPFAR. We deal with a lot of countries where there are social and cultural differences that really present barriers to populations that are at highest risk, like men who have sex with men, injection drug users, and sex workers. These populations participating in what often are illegal activities really do need to have specific special strategies and allow their medical problems to be identified and responded to. I think the unique thing about this meeting is the equal levels of discourse between these groups that normally do not have an opportunity to talk and meet with each other. So I do think it's special. I think that the attendance and energy in the meeting also makes me smile, because I think it's unusual. Often these meetings are not as positive in the general feeling of the crowd that we are at a moment where our understanding of how to stop movement of virus, not only as it progresses through an individual to impact their immune function, but also how that virus moves through populations. And all of it coming together to, as Secretary Clinton was able to say, as Secretary Sebelius so beautifully said, gives us an opportunity to see the light at the end of the tunnel, to really begin to put in place a plan that will eliminate individuals moving into an HIV positive position, so not becoming positive, and for those who are positive, not progressing to AIDS.
Well, that's great. And Eric, thanks so much for your lifetime commitment to this and your leadership for all of us going forward.
Well, and yours as well.
Thank you so much, Eric.
Thank you.
So I'm Dr. Howard Koh at the International AIDS Conference in Washington, D.C.